Not all facials are created equal, from microdermabrasion to oxygen therapy to laser resurfacing. Lord, there's a wide range of options available.
I've tried them all.
Yeah, listen, but with so many choices, how do you know which one is right for your skin?
Dr. Sandra Lee, also known as Dr. Pimple Popper, is here to show us how to pick the best treatment as our skin changes. Is that the key?
Yes, actually the thing that I tell all my patients is your BFF, their skincare regimen is not necessarily yours, because we're all different. We have darker skin, lighter skin, oily skin, dry skin, brown spots, red spots, and
so you need to know your skin.
You need to know your skin, and that's very important. It's actually really great this time because we know so much on the internet. People are telling us things. So really, when you're younger, you really want to do things that obviously treat your acne, treat things that you might have, like mild eczema and things like that. So we have products that are going to treat that. And then when you get older, you want to think of more collagen stimulating treatments.
Yes, give me all the collagen.
Yes, facials and things like that are really nice because they're going to help to brighten up your skin, and they're really a luxury, like doing a massage. But do they do something really big and different? Probably not so much. And we have something called, there are these new products like these masks called carboxy therapy.
No, wait, what is that?
Have you seen the one where they inject under the eyes and you get like bubbles? It's frightening, but this is
give me some of that
I'm
one.
going to put you some. Give you some right now.
What is it?
Yes, and they actually, what's really cool, well, so it's carbon dioxide, and that attracts oxygen, and it's called the Bohr effect. And what that does is that will actually, bring oxygen into your skin, and that's going to help to decrease inflammation, help wound healing. If you leave that on, if you can leave that on for like 40 minutes or so, it will peel off in a really cool way. So there's that too, like kind of like the Elmer's glue that you had back in the day.
Oh, that's pretty cool.
So that's a really great thing to use. I'll put it on me too. So that's called the CO2 lift. And you can get that, actually, there's a non-professional variety, like online. You can get it, I'm sure, on their website. But
is
when
it
you
really
get older,
expensive?
that can be a little bit more expensive, but it depends. I mean, it's really a nice thing that you can do once a month, and it's really great after you're having a more aggressive treatment like laser resurfacing.
Because it's like calming.
Yes, it actually helps to encourage wound healing, so everything moves faster because you bring oxygen.
Look at us.
It's like the hyperbaric oxygen there. You know, when you do hyperbaric oxygen, it's like bringing that onto your skin.
Because I feel how cold it is. I'm also like waiting for this hand to look very youthful.
I know.
And for
and actually,
like death becomes her. It's gonna come back.
Old, so I might need this for both hands.
But so when you get older and you have fine lines and wrinkles, or even you have acne scars, you can do things that are more aggressive. But there is more downtime involved. I think I have some pictures of laser resurfacing. These are my own patients that I've done. I think one had deep lines and wrinkles, as you can see, and I have another one with acne scars.
That's the same person?
Yes, but it's very aggressive. You know, this is something that you have downtime involved. You really have to make sure you're nice and numb and you're nice and comfortable. So
how much downtime?
About a week. Yes, about a week of downtime, but it's not like you're
the next time I take a week's vacation,
it's not like you're paying. You just don't want to see anybody, you know what I mean?
You just want to hide somewhere.
Yes.
This looks, the difference here is amazing.
Yeah, it can really be incredible, and that's really the thing I try to make sure people know. Do these things because you love them, and they can do something, but the more aggressive something is, the more downtime in general, the more effect it might have.
So you have to really kind of meet with whoever your doctor is to say what's the skincare routine I need now, and what am I going to need down the road?
Yeah, and it can be scary too, right? It's intimidating to do that. It's embarrassing, and you want to make sure that they're telling you the right thing, is not just selling what they have in their office.
Well, that's what I get scared about.
So, it is hard.
Something. What about how often should we be getting a facial? And if you don't know all these different things, what kind? If you just are like, you know what, I'm going to get a facial today, what kind do you ask
for? You want to talk about what bothers you. Do you have brown spots that bother you? Do you have fine lines that bother you? Are you really dry? And then they're going to really fine tune that to whatever your needs are. And it just know that it's a luxury treatment. It's going to make your face glow. It might make it a little pink in the beginning, but it's going to go away, and then you might want one in another month. It's a nice thing to do.
Well, definitely good to know. Dr. Lee, thank you so much for joining us. I can't wait for my hand to be born again.
Yes, and definitely get the sunscreen. We're going to check in.